Have you ever received that crushing letter? The one that says, after months, maybe years of waiting, that your claim has been denied, or worse, that you've been rated far lower than you deserve? You look at the stack of medical evidence you provided, the hours you spent gathering buddy statements, and you just feel defeated. You feel like the entire system is rigged against you, designed to wear you down until you just give up. And honestly, that feeling isn't entirely wrong. The standard appeal methods that most veteran service officers, VSOs, rely on, the ones that focus on just refiling the same forms or adding one more generalized doctor's note, those methods are exactly what the VA expects. They are designed to be processed quickly and often denied just as quickly because they lack the necessary legal and medical teeth. They are the path of least resistance for the VA system, and that is precisely why they fail so often. But what if I told you there's an entirely different approach? A strategic, surgical method that shifts the burden of proof, that forces the VA to look at your evidence through a legal lens they desperately try to avoid. A method that successful attorneys and specialized accreditation agents use, but rarely share with the masses because it requires intense, personalized work and a deep understanding of the regulatory codes. This is the appeal blueprint that bypasses the common denial traps, the one that the system doesn't want you to know about because it dramatically increases your chances of success, and it starts right now with the foundational pillar of your entire claim, the medical evidence. We're not talking about just getting a doctor to sign a piece of paper. We're talking about the Nexus Letter Deep Dive. And this is where 90% of claims fall apart, not because the veteran isn't suffering, but because the medical opinion is fundamentally flawed in its legal structure. A standard boilerplate Nexus letter simply states that your condition is consistent with your military service. That phrasing is weak, it's vague, and the VA claims processors are trained to dismiss it immediately. They look for specific regulatory language, and if they don't see it, they move on. They don't have the time or, frankly, the inclination to interpret ambiguity in your favor. They want certainty, and the legal standard you must meet is at least as likely as not. This is a critical distinction, a semantic shift that carries the weight of law. When your private physician uses the phrase, "it is at least as likely as not," that the veteran's condition was caused by or aggravated by the veteran's military service. You have met the minimum legal threshold required by 38 CFR. This is non-negotiable. If your current letter doesn't contain this exact specific phrasing, you need a new letter, or you need to have your doctor amend the existing one. The VA is looking for an easy out, and vague terminology is the easiest out they can find. But we can't stop there. The deep dive means the letter must also be reasoned. It cannot be a simple assertion. It must be a scholarly argument. The VA often dismisses Nexus letters because they claim the doctor hasn't provided the supporting rationale. Your doctor must cite specific, recognized medical literature, peer-reviewed journals, or even VA clinical guidelines that support the link between the in-service event and your current diagnosis. Think about this strategically. If you are claiming tinnitus due to noise exposure, the physician shouldn't just say, "he was exposed to noise." They must cite studies that link impulse noise exposure, common in military occupational specialties, to the long-term development of tinnitus. They need to show their work. They need to demonstrate that their opinion is based on objective, scientific fact, not just a sympathetic feeling for a patient. If the letter is 5 sentences long, it's going to fail. It needs to be detailed, referencing specific service records, dates, units, incidents that you provide. The physician must state explicitly that they reviewed the Veteran Service Treatment Records, STRs, their C file, if available, and the relevant diagnostic tests. This level of detail makes the Nexus letter nearly unassailable. It elevates it from a simple opinion to a piece of expert legal evidence. Furthermore, the deep dive involves anticipating and preempting the VA's counterarguments. What is the VA likely to say? They might argue the condition is congenital or due to post-service trauma or simply aging. Your physician, in their report, needs to address these alternative etiologies and explain why they are less likely than the service connection. For example, if you are claiming a knee condition, the VA might argue it's just osteoarthritis from getting older. Your physician needs to rebut that, perhaps by pointing to specific in-service injuries documented in the STRs, or by noting the aggressive progression of the condition that is atypical for age-related wear and tear, directly linking the current severity to the military event. This proactive defense is the hallmark of a successful claim. It closes the door on the easy denials. It forces the VA rater to confront the evidence head-on rather than simply dismissing a generalized statement. This preparation is meticulous. It is time-consuming. It is why VSOs often skip this step. It's too much effort for a volume-based practice. But for you, the veteran, this level of detail is the difference between denial and life-changing compensation. Every sentence in that Nexus letter must be scrutinized for its legal weight and its medical precision. Now, let's pivot away from the clinical and into the personal, because the second pillar of this hidden appeal method is GENON, the lay evidence blitzkrieg. Most veterans think of lay evidence, buddy statements, spousal statements, personal testimony as secondary or merely supplementary. This is a massive mistake. Under specific VA case law, lay evidence can be just as powerful and sometimes more powerful than medical evidence, especially when service treatment records are incomplete or non-existent, which is a common problem for older veterans or those who served in combat zones where documentation was sparse. The VA has a duty to assist, but if you don't give them a clear map, they will get lost and you will be denied. Lay evidence is your map. The blitzkrieg strategy is built on specificity and corroboration. Generic statements like, "He was always depressed," or "I know he hurt his back in the military," are useless. They are anecdotal and lack the necessary context. What you need are statements that create a contemporaneous record, that place the event in time and space and describe the functional impact of the disability. For instance, a buddy statement should not just say, "We were in Iraq and he got hurt." It should say, "On or about date, while conducting operations near location, Private Smith was thrown from the vehicle during an IED blast. I personally witnessed him immediately grabbing his lower back. For the next 3 weeks, I saw him struggling to put on his rucksack, and he was constantly taking over-the-counter pain medication. His movement was visibly restricted." Do you see the difference? This statement provides a specific date, a location, an event, a witness, and a description of the immediate, observable symptoms. This level of detail is crucial. When gathering spousal or family statements, the focus shifts to the current functional limitations. The VA rates based on severity and inability to work or perform daily functions. Your spouse's statement should detail the specific ways your disability impacts your life today. For example, if you are claiming PTSD, the statement should describe specific triggers, frequency of nightmares, inability to attend public events, difficulty maintaining employment due to paranoia or anger outbursts, and the need for the spouse to perform tasks that the veteran can no longer handle, such as managing finances or driving in heavy traffic. These statements must be vivid, precise, and signed under penalty of perjury. They become part of the official legal record. The VA cannot simply ignore detailed, specific lay evidence that is consistent with the claimed disability, even if the C&P examiner attempts to downplay the symptoms. This is because the lay evidence speaks directly to the severity and the functional impairment, which is the ultimate determinant of the rating percentage. We need multiple layers of lay evidence, hence the blitzkrieg. Don't rely on just one buddy. Try to get 3 or 4, if possible, each corroborating different aspects of the service event or the post-service struggle. Use personal journals or old emails as supporting evidence. If you wrote an email to a friend in 2005 describing your struggles with pain or anxiety, that email is powerful contemporaneous evidence. It shows that the problem existed long before you filed the claim. This strategic use of comprehensive, detailed lay evidence fills the gaps in the medical record, especially in older claims where paper trails are thin. It tells the human story that the cold clinical records often omit, and it forces the VA to acknowledge the reality of your suffering, not just the technical medical diagnosis. This pillar is about overwhelming the system with consistent, detailed personal truth. Now, let's talk about the nightmare scenario, the bad exam. The third strategic pillar is the C&P exam counteroffensive. You walk into the compensation and pension C&P exam, you feel rushed. The examiner seems disinterested, and then, months later, you see the denial letter stating the examiner concluded your condition is not service-connected or is rated minimally. This is where most veterans throw in the towel, believing the doctor's word is final. It is not. The C&P exam is a piece of evidence, not a final judgment, and it is frequently flawed, procedurally or substantially. Your counteroffensive is not arguing the doctor's medical expertise. It is arguing the doctor's compliance with VA regulations. The first step in the counteroffensive is to immediately request a copy of the C&P report, which you are entitled to. You need to scrutinize this document like a forensic auditor. You are looking for procedural errors and factual omissions. Did the examiner fail to review all the evidence you submitted? Did they ignore your private nexus letter? Did they overlook the detailed lay statements? If the examiner states the veteran did not provide evidence of current treatment, but you submitted 3 years of treatment records, that is a procedural error, a clear violation of the VA's duty to assist by failing to consider all relevant evidence. This error is grounds for a higher-level review, HLR challenge, which we will discuss shortly. Next, you look for factual misstatements or inconsistencies within the report itself. Did the examiner misquote you? Did they report that you have full range of motion when you clearly demonstrated limitations? Did they fail to perform required tests, e.g., specific measurements for orthopedic claims? If the examiner's findings are internally inconsistent or contradict objective facts in your medical records, you must document this immediately. You then need to obtain a rebuttal letter from your private physician. This rebuttal is crucial. Your private doctor, having access to your full medical history and spending dedicated time with you, can directly challenge the C&P examiner's conclusions by pointing out where the C&P doctor deviated from standard medical protocol or failed to apply the correct diagnostic criteria. The rebuttal letter should specifically state that the C&P exam is medically inadequate because it failed to address specific evidence A and specific evidence B, or because the opinion is based on a factually inaccurate history. This counteroffensive is about creating doubt in the validity of the VA's chosen evidence. You are essentially telling the VA, you relied on a flawed examination, and therefore your denial is based on an inadequate foundation. You are using the VA's own rules against them. Remember, the VA is required to consider all evidence of record. If the C&P report shows the examiner failed to do this, that report loses its weight, and the VA is often forced to order a new, more comprehensive exam, or, in the best case, scenario, grant the claim based on the weight of your private evidence. This requires meticulous record-keeping and a willingness to challenge authority, but it is one of the most effective ways to overturn a denial based on a single, negative exam. Never accept a bad C&P report as the end of the road. Treat it as the next battlefield in your appeal. Moving on to the fourth pillar, we focus on proactive control. The Disability Benefits Questionnaire, DBQ, strategy. The VA uses the DBQ forms internally to guide their examiners and ensure they hit all the regulatory criteria required for rating. When you rely solely on the VA's C&P exam, you are allowing the VA to control the entire narrative. They choose the doctor, they control the environment, and they control the focus of the examination. The successful appeal method flips this dynamic entirely by utilizing private DBQs. The DBQ is essentially the rating schedule in question form. By having your private physician complete the specific DBQ relevant to your condition, e.g. the PTSD DBQ, the musculoskeletal DBQ, etc., you are ensuring that all the necessary rating criteria are addressed comprehensively and accurately from your perspective. This is not just about filling out a form. It is a strategic briefing for your private doctor. You need to provide your physician with the exact rating criteria, the 38 CFR sections, for your condition, explaining what the VA is looking for, e.g. frequency of panic attacks, limitation of flexion in degrees, etc. You are turning your physician into an expert witness who is completing the VA's own checklist, but with your best interests at heart. When a private DBQ is completed accurately and thoroughly, it becomes incredibly difficult for a VA claims processor to justify a denial or a low rating, especially if the private DBQ contradicts a VA C&P exam. Why? Because the private DBQ is often more detailed, based on a longer patient-doctor relationship, and crucially, it uses the VA's own language and format. If your private DBQ checks all the boxes for a 70% rating and the VA C&P examiner checks boxes for a 30% rating, the VA now has a conflict of evidence. In this conflict, the VA is required to reconcile the two, often by favoring the evidence that is more thorough and based on a longer history of care, which is typically the private DBQ. Furthermore, if you are appealing a low rating, the private DBQ can focus intensely on the specific areas of functional impairment that lead to a higher percentage. For instance, if you are stuck at 50% for mental health, the private DBQ can meticulously detail the occupational and social impairment that qualifies you for the 70% or 100% scheduler rating. The strategy here is control and standardization. By submitting a private DBQ alongside your Nexus letter, you are providing the VA with a ready-made, perfectly formatted piece of evidence that speaks directly to the rating schedule. This minimizes the chance of the VA rater making an error due to misinterpretation or omission. It is an advanced technique because it requires the veteran to deeply understand the rating schedule and communicate that understanding to their physician. But the payoff is massive. It takes the power out of the VA's hands and puts it firmly in yours. Never underestimate the power of presenting the VA with evidence that is structured precisely the way they prefer to see it, but which overwhelmingly supports your claim. Moving into procedural warfare, the fifth pillar of this hidden appeal method is the higher level review, HLR, trapdoor. When a claim is denied, most veterans immediately think they need to submit new evidence, which leads them down the supplemental claim path. While supplemental claims are necessary for new evidence, the HLR is a far more strategic option in specific scenarios, and it is often misunderstood as merely asking a senior reviewer to look at the same denial. This is incorrect. The HLR is a powerful trapdoor used to catch the VA in procedural or factual errors, forcing them to reverse course or initiate a new, favorable action. The HLR is based on the evidence already in the file at the time of the original decision. You cannot submit new evidence. This forces the reviewer to focus solely on whether the previous decision-maker made a mistake based on the existing record. The strategic genius of the HLR lies in specifically targeting the VA's duty to assist and duty to notify. You must meticulously review the denial letter and the evidence summary to find where the VA failed to uphold its regulatory duties. Did the rater ignore your detailed lay statement? Did they fail to seek clarification from the C&P examiner when the report was vague? Did they fail to order a necessary exam? If you can identify a clear, demonstrable error in how the VA processed the claim, not just disagreeing with the outcome, but finding a regulatory mistake, the HLR becomes incredibly effective. The trapdoor analogy comes from the power of the informal conference. When you file the HLR, you're entitled to an informal conference with the higher-level reviewer. This is your opportunity to verbally point out the exact error in the file. You don't argue the merits of your disability. You argue the process. You say, "Sir, ma'am, on page 47 of my C file, I submitted a nexus letter from Dr. Jones dated June 15, 2023. The denial letter, under the Evidence Considered section, does not list this document, and the rationale for denial does not address its conclusions. This is a clear duty to assist error because relevant evidence was not considered." By pinpointing the exact location of the error, you make the reviewer's job easy, and they are then compelled to find an error. When the HLR reviewer finds an error, they issue a duty to assist error, or difference of opinion finding, which generally results in the claim being sent back for correction. This correction often means a new C&P exam, or if the error was purely administrative, a new decision granting the claim based on the evidence that was previously ignored. The HLR is fast, relatively speaking, and it is a pure test of regulatory compliance. It is the perfect tool when you know you had the right evidence, but the rater simply missed it or misunderstood it. It avoids the lengthy process of gathering new evidence and starting a supplemental claim. It is a strategic pause that forces the VA to clean up its own house, often leading to a much stronger position for the veteran moving forward. Do not waste the HLR on simply hoping for a better outcome. Use it surgically to expose procedural flaws. Our sixth advanced strategy takes us to the highest level of appeal. The Board of Veterans' Appeals, BVA, direct dockets. When the HLR or supplemental claim path doesn't yield the results you need, the next step is the board. However, many veterans and VSOs default to the hearing docket, thinking a personal appeal is necessary. While hearings can be powerful, they are often the slowest path, sometimes taking years to schedule. The hidden secret of the BVA is the strategic use of the direct docket. The BVA direct docket is designed for cases where the veteran believes the file is perfect and requires no new evidence or testimony. They simply want a veterans law judge, VLJ, to review the existing record and make a final decision. Why is this often avoided? Because if your file isn't perfect, the VLJ will affirm the denial, and you've wasted your time. However, if you have meticulously followed the first 5 steps, a legally sound nexus letter, detailed lay evidence, successfully rebutted any bad C&P exams with private DBQs, and utilized the HLR to ensure all evidence is officially considered, then your file is ready for the direct docket. The direct docket is the fastest route to a BVA decision, often shaving years off the wait time. By selecting this docket, you are essentially telling the board, "My evidence is overwhelming, and I challenge you to find a IC regulatory reason to deny this claim." This strategy works best when the evidence of service connection and severity is undeniable, and the previous denials were clearly based on errors of law or fact interpretation by the regional office. It requires absolute confidence in the quality of your submission. If you have any doubt about the completeness of your evidence, choose the evidence docket, which allows for a limited time to submit new evidence. But if you have executed the previous steps flawlessly, the direct docket is the accelerator pedal for your appeal. Furthermore, when filing the BVA appeal, you must be extremely precise in identifying the specific issues you are appealing and the relief you are seeking. Do not use generalized language. State exactly which conditions, which rating percentages, and which effective dates you are fighting for. The VLJ is focused on finding errors of law and determining if the evidence preponderates in your favor. By presenting a clean, complete, and legally structured file via the direct docket, you remove all the administrative noise and force the VLJ to focus solely on the merits of your claim. This is a high-risk, high-reward strategy, but when properly executed, it is the method that leads to the fastest, most definitive victories. The VA system doesn't want veterans to realize they can bypass the bureaucratic slowdowns by simply ensuring their initial submissions are legally flawless, making the direct docket a viable and powerful option. Finally, we come to the seventh and often most lucrative pillar of this successful appeal method: the secondary service connection. Blueprint. Many veterans achieve a rating, perhaps 30% or 50%, and then struggle to move higher because their primary service-connected conditions have reached their maximum rating based on their severity. The key to breaking through the 70%, 80%, and 100% barriers is connecting new conditions, not as primary claims, but as secondary consequences of the conditions you are already rated for. This is the domino effect strategy, and it is a massive oversight in standard claims filing. Think about the human body as a complex system. If you have a severe knee injury, primary service connection, how does that impact the rest of your body? The secondary connections are numerous and predictable. You favor the uninjured leg, leading to hip, back, or ankle strain in the compensating leg. That is a secondary orthopedic claim. The chronic pain from the knee injury requires medication, NSAIDs, opioids, which can lead to secondary conditions like GERD, irritable bowel syndrome, or other digestive issues. That is a secondary internal medicine claim. The constant unrelenting pain and limited mobility often lead to depression, anxiety, or insomnia. That is a secondary mental health claim. The secondary service connection. Blueprint requires a strategic nexus letter that links the rated disability to the new disability. The legal threshold is the same, at least as likely as not, but the mechanism is different. Instead of linking the condition to a service event, you are linking it to an existing service-connected condition. For example, your physician writes a nexus letter stating, "It is at least as likely as not that the veteran's newly diagnosed major depressive disorder is proximately due to or aggravated by the chronic intractable pain and functional limitations caused by their service-connected lumbar spine condition." This is a powerful claim because the VA has already acknowledged the foundational injury. You are simply demonstrating the ripple effects. This strategy is crucial for maximizing your overall compensation, especially when attempting to achieve total disability individual unemployability, TDIU. Often, it is the cumulative effect of the secondary conditions, the pain, the digestive issues, and the mental health complications that truly prevents the veteran from maintaining substantially gainful employment, not just the single primary condition. By systematically identifying and claiming every plausible secondary condition, you increase your overall combined rating dramatically. This is the advanced planning that separates the successful claims from the stalled ones. The VA doesn't advertise this method because every successful secondary claim increases their payout obligations, but it is entirely within the regulatory framework and is the most effective way to achieve a truly comprehensive and accurate rating. Never stop at the primary condition. Always ask, what else has this condition caused or aggravated? The strategic appeal method we have detailed, the deep dive nexus, the lay evidence blitzkrieg, the C&P counteroffensive, the DBQ control, the HLR trapdoor, the BVA direct strategy, and the secondary blueprint. These are not just suggestions. They are the required components of a successful, modern appeal. They require diligence, research, and a willingness to step outside the standard VSO process that often relies on volume over surgical precision. What is the core takeaway here? It is this: success in the VA system is not about how much you suffered, but how effectively you translate that suffering into legally compliant, medically supported evidence. The VA system is an administrative and legal one, not a purely medical one. If you treat your appeal like a legal case, focusing on regulatory language, procedural errors, and the specific evidence required by 38 CFR, you fundamentally change the dynamic. You move from being a supplicant hoping for sympathy to being a claimant demanding compliance with the law. This strategic shift is what the VA system, with its layers of bureaucracy and high denial rates, truly does not want you to realize. They want you to use the standard, easily dismissed forms. They want you to quit. But armed with this blueprint, you have the power to force the system to acknowledge the truth of your service and your sacrifice. Do not accept the first denial. Do not accept the low rating. Take control of your claim. Use these advanced strategies and fight for the compensation you have earned and deserve. The time for passive appeals is over. The time for strategic surgical action is now.